Part two, picking up where we left off before we got that call. As I was saying with the head to toe, a lot of people don't want to check the genitalia region. It's not comfortable for us, it's not comfortable for them. However, you will find such things as incontinence or priapism. That can save the patient's life or give you a clue on what is actually going on. I personally have caught that on shootings. Patient was shot in the abdomen, thought it was a through and through, ended up being that it hit their spinal cord on the way out. They had a priapism. So something about that, just a lesson learned on my part, is check that. From there, you got your vital signs. Vital signs are part of your patient's assessment, so you need to go through all of them. Everybody has questions on what vital signs are, so I'm going to go through a list of what we have on our paramedic upgrade class sheet. Respirations, heart rate. Those are two things that you're going to get done in your initial assessment up here in your primary. You're going to check your pulse rate, rhythm quality, and your breathing rate, depth, and quality. Blood pressure, putting them on the monitor, getting that done. You can also do it manually for your EMTs out there. SpO2 is something very important nowadays with COVID. People are having what's called happy hypoxia. They don't realize they're hypoxic with COVID, so they're presenting with hypoxia, and the only way to know that is by checking their SpO2. EKG, checking what their heart rhythm is, as well as an EKG. If you're doing a 4 lead, do a 12 and a 15 as well. It just rolls through it. Make sure if you're doing that 12 lead, you're definitely getting a 15 to check. BGL, if they're unresponsive, altered in any way, checking their sugar, or if they have a history of diabetes. A body temp is very important once again with COVID, and checking end-tidal CO2. Making sure we're checking all that, especially with respiratory patients. Checking their waveform can give us the various aspects of what is going on if they have bronchoconstriction or they have other issues going on. Lastly are your treatments. Treatments are the final part of your patient assessment. It's just what you do to help that patient improve, what you did throughout your treatment transport of that patient. Treatments are something that gets relayed to the hospital when you get there. Starting from the beginning, everything. Give the hospital a good picture. Make sure you're brief though. They don't want to listen to us for 25 minutes giving them a dissertation on what is going on. So as you saw, my assessment was patient assessment. Look forward to taking more classes, and thank you very much.